Welcome, and thank you all so much for joining us today. I'm Dr. Gwendy Reyes-Zilla, Co-Executive Director of the Veterinary Association for Farm Animal Welfare. For those of you who are unfamiliar with VAFAW, our mission is to advocate for animals used in food and fiber production by providing a veterinary perspective grounded in animal welfare and ethics. We do this through education, policy development, and advocacy. If you're not yet a member of VAFA but would like to become one, please send us your name through the Q&A box located at the bottom of your screen or visit www.vafaw.org. Membership is open to anyone who supports our mission, and the first year of membership is free. VAFA currently has 3 areas of focus: preventing and mitigating pain experienced by farm animals, promoting living environments that meet animals' physical and psychological needs, and ensuring humane end-of-life practices. As part of our webinar series, Ensuring Humane End-of-Life Practices, we have 2 expert speakers joining us today to discuss how highly pathogenic avian influenza, or HPAI, a disease that is now endemic in the US. HPAI is truly a One Health issue with a significant impact on animal welfare, agriculture, public health, and even conservation and biodiversity. As you may know, in the event of a disease outbreak like HPAI, methods of depopulation are employed on farms. Depopulation refers to the rapid destruction of large numbers of animals in response to an urgent circumstance. Mass depopulation and euthanasia are not synonymous, and the depopulation methods currently used in the US do not ensure that the animals' deaths are free from pain and distress. Over 190 million commercial birds in the US have been depopulated since HPAI was first detected here in early 2022. Tens of millions of these animals, potentially over half of the total, have been destroyed via heat stroke-based depopulation methods such as ventilation shutdown plus, which significantly compromise animal welfare. In addition to promoting a transition to higher welfare depopulation methods, VAFA aims to reduce the risk that depopulation will need to be undertaken in the first place. As veterinarians, we seek to understand and mitigate the factors that make animals more vulnerable to circumstances that result in depopulation. And when it comes to disease control, we support interventions such as vaccination that reduce animals' vulnerability to both infection and depopulation. Both of our talks today deal with these themes. We will begin with a presentation from Dr. Thijs Kuiken, Professor of Comparative Pathology at the Department of Viroscience at Erasmus University Medical Center in the Netherlands. He studied veterinary medicine at the University of Utrecht and obtained a PhD in pathology from the University of Saskatchewan. Dr. Kuiken has over 30 years of experience studying emerging viral diseases, and today he will be discussing HPAI from a One Health perspective. Following Dr. Kuiken, we will hear from Dr. Charles Martins Ferreira, Deputy Agricultural Counselor at the French Embassy in Washington, D.C. He obtained his veterinary degree from the National Veterinary School in Nantes, France. Dr. Martins Ferreira has extensive global experience in sanitary and phytosanitary issues and currently monitors HPAI. Today, he will be discussing France's HPAI vaccination program with us. After we hear from our speakers, we will follow up with a question and answer session. So throughout the webinar, you are welcome to submit your questions through the Q&A button at the bottom of your screen, and we will address as many of these questions as time permits. I will now turn things over to our first speaker, Dr. Thijs Kuiken, and we'll give you a moment to share your screen.
Okay, can you see the screen, Gwendy?
Yes, looks perfect.
Okay, thank you very much. And thank you for inviting me to give a presentation at this webinar. My presentation is about the One Health approach to HPAI and its impacts on intensive poultry production. In the next 40 minutes, I'll be telling the following story, namely that we in high-income countries are eating more chicken meat and eggs than we need to for a healthy diet, and that to meet this demand, poultry production worldwide is increasing by 500 million birds together with other negative impacts on health and nature. And therefore, we need transformative changes both in poultry consumption and in poultry production patterns. So just to give you an idea about how much meat we eat, I've put here on the screen two different figures, one from North America and one from Africa, showing the trend in the annual per capita meat consumption in both these continents. So you can see that in North America, the total amount of meat eaten per year is around 100 kilograms, whereas in Africa, the average meat consumption per person over a year is around 18 kilograms. And according to the guidelines of the Eat Lancet Commission, which is a commission that has made guidelines for the diet, balancing both human health and also environmental sustainability, the maximum meat consumption would be about 300 grams of meat per week. That is 21 kilograms per year. So from this graph, you can see that the average African does not reach this amount. It's 3 kilograms below that. In contrast, the average North American goes about 5 or 6 times higher than that per year. This has consequences for human health. Here we have a comparison of mortality rates in young children in different parts of the world. And you can see that in sub-Saharan Africa, the rate of mortality of young children from protein and energy malnutrition is about 43 children per 100,000 a year. In comparison, in high-income countries like in Europe and in North America, the mortality rate from this problem is virtually zero. So these differences really are important, and it's important to take this into consideration. We eat a lot of meat in high-income countries, partly because of advertising. And there's a well-known citation from Professor Wesley Garrigus from the University of Kentucky at the end of the 1980s, who proudly states that aggressive marketing methods have increased the per capita consumption of broilers, that is meat chickens, more than 5-fold in the 3 decades beginning in 1950, and expects that further increases are predicted for the future. So that partly explains the high meat consumption rates in high-income countries. And as a result of this high production, there is also an enormous population of poultry worldwide, and it is growing rapidly. So on the graph on the left, you can see that in 1961, the worldwide population of chickens and other poultry birds like turkeys, ducks, and geese was around 5 billion. By 1997, it had tripled to 15 billion. And 25 years later, in 2022, it had doubled to 28 billion. And the rate of increase appears to be fairly constant in the last 20 years at 500 million poultry birds per year. And as a result, the actual global biomass of chickens and other poultry by far outsizes the global biomass of all the wild birds in the world. So 70% of global biomass consists of chickens and other poultry, whereas an estimated 30% is all the rest of the avian species in the world. Again, quite a dramatic figure. This global population of poultry is not distributed evenly around the world. In certain parts of the world, there are concentrations of these animals, and these are called poultry-dense poultry areas. And this is relevant because in some cases, the impacts of poultry production are there independent of how the distribution of the animals are. But in other cases, when there is a concentration of animals in a particular area, the impacts of the production methods are also concentrated in those areas and therefore can be more important. So that's something that we'll come back to later on. And you can see that there are poultry-dense poultry areas in different countries in the world, in the United States, for example, on the east coast of the US, in Brazil, in the southern part of Brazil, in Europe, in various parts of Europe, including the west of France, where the next speaker will be talking about, in the UK, in the Netherlands, where I'm living and working, and also in different parts of Asia, for example, in the southeast parts of China. And it's important to realize that this increased poultry production contributes to human society's effect on the so-called planetary boundaries. And these planetary boundaries are a framework that identifies 9 basic processes that are critical for maintaining the stability and the resilience of the Earth as a global system as a whole. And in 2023, 6 of these planetary boundaries had been exceeded, and they're listed here: climate change, biodiversity, land system or land use change, freshwater change, biochemical flows, especially nitrogen and phosphates, and also novel entities, for example, plastics and PCBs. And we'll come back later to what the actual contribution is of poultry production to this exceeding of planetary boundaries. In the first place, this global poultry production has major impacts on carbon emissions and on land use. Here is the estimated meat and egg production from poultry producers in 2022. And from that production, one can estimate what the CO2 emissions are. And in 2022, the estimated CO2 emission per year from poultry production is 1.1 gigaton. And for comparison, the total emission of CO2 from all of human societies is about 40 times that, 40 gigatons. Also, with regards to land use, the amount of land that is used to grow crops for poultry production, for example, maize and soya beans, it's estimated that 2.3 million square kilometers are used to feed the world's poultry population. And for comparison, that's about 5% of the total amount of area of land that is used for all of agriculture. And it's about 6 times more than the area of California. So I told you that in some cases, the impacts of poultry production are increased in poultry-dense poultry areas. And actually, the country where I live, the Netherlands, is an example of such a poultry-dense poultry area. If you look in the figure on the left, it shows you the poultry density, that is the number of poultry birds per hectare of utilized agricultural land in different countries of the European Union. And they're ranked in order, with Netherlands right at the top, with an amount of 60 poultry birds per hectare, which is 6 times higher than the EU average, which is 10. So that really is a very high density of poultry that we have in the Netherlands. And a few years ago, a multi-university study took place in the Netherlands to investigate the effects of livestock production, including the production of poultry in the Netherlands, on the environment and on public health. And as we saw for global poultry production, the production of poultry in the Netherlands also has an impact in relation to global warming. Greenhouse emissions are 9 million tons of CO2 equivalent per year. And also land use is substantial, namely 8,400 square kilometers of land, which is about a quarter of the country. Besides that, something which is very important locally is that there's a high nitrogen deposition from poultry producers. And this has an effect, a negative effect on local terrestrial nature, because there are multiple plant species that can't take high nitrogen levels. And the emissions from poultry production are 4% of the total of the national depositions of nitrogen, which also come from other livestock, from vehicles, and from industry. Poultry production has also negative impacts on public health because of this concentration of poultry in a relatively small area. Especially laying birds emit fine particulate matter, and people living in the area around poultry farms suffer from premature death and an increased risk for respiratory diseases and cardiovascular diseases, in total resulting in 1,900 disability-adjusted life years less because of this exposure. Furthermore, the presence of poultry results in an increased transmission of endemic zoonoses. So these are zoonoses that are always present in the poultry population, especially Campylobacter infection, resulting in something like 1,300 DALYs per year. Then the subject of today's talk, the risk of emerging zoonoses is increased, including that from HPAI. In this study, the risk was considered moderate, and the potential consequences were serious, namely a start of a new influenza pandemic. And then last, but certainly annoying for people who are living around poultry farms, is the severe odor annoyance. And there were complaints from 3% of the population in some municipalities, which is considered to be high, considering that only a small number of people go to the bother of making such complaints. So going now to focus more in the actual subject of today's talk, the number of HPAI outbreaks per decade has increased with the expansion of the global poultry production. So on the right, you can see the same graph as I showed before, the change over time in the global poultry population size. And on the left, you can see in blocks of 10 years, the number of new HPAI outbreaks per decade. And you could see that correlated with the growth of the poultry population, there's also been a rapid increase in the number of new outbreaks, where in the 1950s, there was only one new outbreak per decade. Starting from 2010, there were over 15 new outbreaks per decade. So a substantial increase over time. And given that the poultry population is expected to increase in coming years, the number of new emerging HPAI events is also considered to increase. So bringing this together, increased poultry population not only has an impact on increased risk of avian influenza outbreaks, but also has a role in climate change, biodiversity loss, land system change, and changes in biogeochemical flows like phosphate and nitrogen. Concentrating now on highly pathogenic avian influenza, there's been a review of the new emergence events of HPAI between 1959 and 2015. And in that period, about 40 emergence events had been reported. And this review is interesting. It's by Dr. Dingra, who's now working with the FAO, in three aspects. In the first place, this review shows that in nearly all the cases, these emergence events occur in intensive poultry systems, 36 out of 39 of the reports. It also shows in time that there's a significant increase in emergence events, as I also showed you in the previous graph. In the first half of the study period, there were 3 times less emergence events than in the second half of the study period. And in space, we see that wherever there are poultry around the world, there also can be such HPAI emergence events. And the highest number of emergence events are seen over this period in Europe. So now I'm going to concentrate on just one of these 39 emergence events, the one that is shown by this red dot that started in Southeast China. And this emergence event happened in 1996 in a domestic goose farm in Guangdong province. This virus is the predecessor of the virus that is currently spreading around the world, and this virus is said to belong to the goose Guangdong lineage of H5 HPAI viruses. And from here on, I'll name this HPAI H5. So this single emergence event of HPAI H5 has had a greater impact than all of the other HPAI outbreaks taken together. In terms of numbers of lives lost, it has affected poultry. So by 2023, more than 400 million poultry birds had died or had been culled, depopulated, as Gwendy said just now. In terms of wild birds, this virus has been reported in 528 species of 25 different orders of wild birds. We don't know how many have died because the surveillance system doesn't actually record or make an assessment of the mortality in wild birds, but we estimate that at least tens of millions of wild birds have died in this period. The virus is also a zoonosis. There have been more than 1,000 reports of infected people in the period since 1996. And out of these, approximately half of them have died from this disease. So it's really a severe disease if you get it, although the virus is not very infectious for people. And in terms of other mammalian species, either wild or captive. In total, 94 species in 27 families of mammals have been found to be infected. And again, we don't know how many have died, but we estimate that it is, again, in the millions. So really, this virus has had so far and continues to have an enormous impact in terms of mortality. Its geographical spread is also astounding. Since this virus emerged in Southeast Asia in 1996, it circulated there for a few years, and then subsequently it spilled over into wild birds, something which is unique for this virus, and was able to be maintained in wild bird populations for some time, and in this way was able to spread over long distances to Europe, to the Middle East and to Africa, and also to North America. A major spillover into North America happened in 2021 when the virus crossed the Atlantic Ocean and reached Newfoundland. And in the next year, in 2022, it spread right across North America, and then in 2023 through South America. And at the end of 2023, beginning of 2024, it spilled over into the continent of Antarctica, where no people live, but where many species of seabirds and marine mammals live that are susceptible to this disease. So here is an overview of the 528 different wild bird species that have been diagnosed with HPAI. And what is important to realize is that this is really something which is unique for the current outbreak. In the period before this outbreak, so pre-Goose Guangdong lineage, there were no wild birds that were known to be infected, at least for some time, with this virus. It was only a virus that occurred in farmed bird populations. And the wild birds that had avian influenza were infected with the non-disease causing form, the low pathogenic avian influenza virus. Here is also an overview of the different mammalian species, 95 in 28 families that have been infected. And again, before this HPAI H5 outbreak, mammals were really not considered to be infected with the HPAI. And I've put a circle around dairy cows here because that's, I think, very relevant for North America. Uniquely in the United States, this virus has spilled over from wild birds into dairy cows. And this slide gives you an overview of the early epidemiology of this disease in dairy cows. It first was found in early 2024 in dairy cows in the southern United States. These were dairy cows that were held in open feedlots with these drinking baths. Once it had arrived in dairy cows and uniquely again did not infect the respiratory tract, but instead infected the mammary gland and caused mastitis. The virus spread probably via milking machines that became contaminated, and in this way was able to spread within farms via dairy parlors. However, in the United States, there is also the habit of transporting lactating dairy cows from farm to farm. And as a result of this between farm transport of lactating dairy cows, by April of 2024, the virus had spread from the 3 states that it started in at the beginning of the outbreak. It had already spread to northwest United States and to northeast United States. And the expansion of HPAI H5 in dairy cows to date continues. So by by August 2024, it had been found in nearly 200 farms in 13 states of the United States. And as of today, in February 2026, over 1,000 farms have been infected since the beginning of the outbreak in 19 states. And that includes the state of California, where 1/5 of the total dairy cow population of the United States resides. And this outbreak is not under control yet. So just to give you an overview of the epidemiological changes that this HPAI outbreak has shown compared to previous HPAI outbreaks, I made this table and also show you very summarily the potential implications for surveillance. So before this outbreak, there were no HPAI viruses in wild birds, but now that there are, wild birds are sampled mostly by dead bird sampling instead of live birds as they had been sampled previously. Because the virus has a broader tissue tropism in wild birds, nowadays swabs are taken not only from the cloaca, as had been carried out before, but also from pharyngeal swabs. And to really increase the sensitivity of detection, it's good to take brain swabs as well, as is being done in some countries in Europe. Because of the increased host range in wild birds, it's important not only to survey waterfowl and waders, which are the traditional hosts of avian virus in the wild, but it's necessary to look out to an increasing number of bird species. And because the virus is now infecting mammals more and more, there is more and more need for an actual structural surveillance of HPAI in wild mammals. With regards to the time when the virus occurs in wild birds, it used to occur only in the autumn and winter, at least in the northern hemisphere. Now it's present in wild birds year-round, which means that not only migratory or wintering birds need to be sampled, but also breeding birds in the spring and in the summer. Because the virus is persisting in the wild bird metapopulation from year to year, this requires a different approach to sampling. It's important to take into consideration the age of the birds, because the first-year birds are now more sensitive to infection than older-year birds that may have already seen the virus before. It's becoming more important to do serology rather than just taking swabs for virology to be able to detect antibodies. And also to be able to identify what might be the reservoir species in which the virus is persisting in the wild bird metapopulation. And because this virus is now not only of concern to the poultry industry, but also of concern to wildlife, wildlife health protection should become an additional goal of avian influenza surveillance, and other methods are needed to more accurately assess the impact of the virus on wildlife populations, so that we know exactly what, or more precisely, what the impact is on wild birds and wild mammals over time. So if you look at what kind of response options are possible and wish to take a One Health approach to this, it's important to remind ourselves what the definition is of the One Health approach. The One Health approach is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. So currently, there is no such even attention to the health of people, animals, and ecosystems. We focus mainly on the health of people and give less attention to domestic animals, even less attention to wild animals, and hardly any attention to ecosystems. So to change this way of thinking requires a fundamental change in human nature relationships. And it also requires a vision that is not centered only on humans, an anthropocentric vision, but a more ecocentric vision or a holistic vision. And there are two recent reports that I want to bring to your attention that support this One Health approach. And I don't have time today to go into these reports, but I do provide you with the links to them. And if you are interested in this One Health approach and want to explore it further, I really can recommend reading these reports. So, for example, the Nexus report, like the One Health approach, also takes a holistic vision. And when it addresses problems, it tries to understand the interlinkages between different sectors and different systems. And here the different areas that were examined in this report were biodiversity, water, food, health, and climate change. And by looking at their interlinkages, it tries to come up with response options that maximize the synergies between these systems and minimize the trade-offs. If we look at the other report, the Transformative Change report, it also includes in its discussion and vision a fundamental change in human nature relationships. So this figure shows you in a pictorial sense the changes that are meant to happen by transformative change from the current world, the circle on the left, to the future world, the circle on the right. And I just want to give attention to one of the four visions. There's a change from the prioritization of short-term individual and material gains to one of respectful and reciprocal human nature relationships. This report, by the way, was accorded to by all the nation states that are a member of IPBES, and that includes nearly all of the EU countries, and also includes the United States before the United States left IPBES a few weeks ago. So coming to One Health response options. First, I would like to discuss response options with regards to poultry consumption in high-income countries. So if we want to deal with the problem of the increasing poultry production and the associated increase in risk of HPAI, response options are to adjust consumption to protein need for a healthy diet. And that means a much smaller amount of protein than the currently amount of protein consumed by the average person in high-income countries. Also, a switch to a more plant-based diet, which means that we don't need to have so many animals to provide our protein source, but instead make use of plants to do that. And thirdly, but importantly, also to reduce food waste. And again, referring to the graph that I started off with, here we see the average diet in two high-income countries. Here I have both the United States and the Netherlands. And I specifically indicate how the amount of poultry and egg consumption in these diets in the Netherlands and the United States would change if it were to be the diet that is recommended by Eat Lancet. So it would mean that there would be a substantially smaller consumption of chickens from either 50 to 150 grams down to 30 grams per day, and also a substantially lower amount of egg consumption from around 40 to around 10 eggs. We then go to response options according to the One Health approach that fit with poultry production. On the short term, it would mean adjusting HPAI surveillance to the constantly changing epidemiology of the disease to be able to know as soon as possible when the virus is present in a country and which species it's affecting. With regards to culling, which is performed both in North America and in Europe and in other countries, it's important to ensure that poultry population size is in balance with the capacity for humane culling. So in Europe, it's forbidden to cull or to depopulate farms by way of ventilator shutdown plus. And instead, the way that poultry birds are culled in Europe is by sealing off barns and then introducing carbon dioxide to suffocate the birds. In many cases, this works well, but there is sometimes when there are a lot of animals dying and when very big farms are affected, there's sometimes people in European countries are working at the maximum capacity of using carbon dioxide. And there is a concern in some European countries about the increasing poultry farm size, that this would make it no longer possible to be able to cull poultry in this way, because the population size of a particular farm that's affected then is larger than the capacity for humane culling by use of carbon dioxide. And then another way to deal with this is to vaccinate poultry instead of culling them. So we'll have a talk about that following this presentation, because vaccination is taking place in France in domestic ducks. And there is also advanced proposals to vaccinate laying hens in the Netherlands. In the long term, the way to deal with these problems of increasing poultry population and associated impacts on health and nature are to reduce farm size and farm density, especially in dense poultry areas. And also, specifically with regards to HPAI, to relocate poultry farms away from waterbird areas, because it's especially in those areas that there's a much higher risk for poultry farms to become infected with HPAI in the first place. So by reducing poultry production in high-income countries, so this is indicated by the bell curve on the right, the capacity of the Earth to have a big poultry population is increased for low-income countries where there is malnutrition and where there then is space for sustainable intensification of poultry farming in order to increase the quality of the average diet of people living in those low-income countries. This would be not only a sustainable, but also a just solution for the future. So I haven't had time to actually go into how to carry out these recommendations, but again, I would like to make you aware of the two IPBES reports. For example, the Nexus report has a very detailed roadmap from how to carry out these sometimes quite far-reaching recommendations. So this can be found in that report. So with that, I'll conclude by stating that in high-income countries, people eat more poultry meat and eggs than they need for a healthy diet, which results in excess poultry production, which impacts biodiversity, climate, health, including an increased risk for HPAI. And on a positive note, because these problems are human-caused, it's also in our power to solve them in a just, a more animal-friendly and sustainable way, using a One Health approach. So I'd like to acknowledge the EFSA AI working group, in which I have of which I've been a member for several years, and also the OFLU Wildlife Group, of which I've become co-chair last year, and also the organizations in the European Union that fund my research, CAPAFLU and VO. Thank you for your attention.
Thank you so much, Dr. Kuiken, for that presentation. We are just going to work on getting switched over to Dr. Martins Ferreira. And just a reminder to our audience, if you have questions that have come up, please put them in the Q&A box at the bottom of your screen, and we're collating those questions, and we'll get to as many of them as we can after the next presentation.
Thank you so much, Wendy, for inviting me to this webinar about our experience in France on vaccination. So Abby, you will be the master in handling my presentation. So next, just a few words of introduction. So I will give you some insights of what is, for us, quite original public policy response to a very accurate and very severe problem, HPAI in France. And for that, we have to come back to the very particular epidemiological situation we were facing a few years ago. Next. So you see, I've presented here some waves, some tsunamis. You know, of course, you recognize the Japanese origin. But it's very illustrating of the situation and the waves of HPAI outbreaks we have been facing during this last decade. And you can see that in the winter 2021-2022, we have faced, or we have declared, about almost 1,400 outbreaks. Quite a huge amount of outbreaks in a season, so it's winter season, so in a few months. A lot of outbreaks in poultry sector. And the other years, from 2020 to 2023, about 400, 500 outbreaks per year, which is already a lot. And just to echo what it has been already said, most of these outbreaks appeared in high-risk areas, most of them in the western part of France, just beneath this migratory flyways, of course, and it's also regions north of France, western part of France, but nearby Brittany and more to the south, where you have a high density of flocks, in particular ducks. Next, please. So this unprecedented situation, in particular in 2021, 2022, with almost 1,400 outbreaks, resulted in one hand in massive poultry culls. And you can see in 21-22, we had to kill about 20 million poultries. And in the other hand, we had to face extremely compensation payments to breeders, and thanks to public money. So you can see that in direct cost, state had to cover 621 million euros, and with the indirect cost, finally it was almost 1 billion euros in compensations, just only for 1 year. So this situation could not happen again. It was too much, and also too much because, well, the zoonotic risk has increased clearly. We had to face also problems, social problems with the breeders. They were completely distressed. Moral distress has been, of course, seen in the farms. Our colleagues in the veterinary services were completely exhausted to face all these different outbreaks. And at the end, French society could not bear anymore this situation with so many these mass killings of birds. And finally, it was, I would say, meat put in the bin. So that was not acceptable anymore. And as I said already, this represented an excessive burden on public finances. So in 2021, during this very hard period season, we said, stop, we need to find a solution to this particular situation. That's why we should try vaccination. And in July 2022, we approved internally with the Ministry of Agriculture a roadmap that we have shared with different stakeholders to finally go to deploy this new vaccination campaign. So you just have in mind that at that time, vaccination at EU level was completely forbidden. It was the framework, the regulatory framework could not provide with such kind of vaccination. So we ask also the Commission to review the regulatory framework to allow France vaccinating, of course. And at that time also, we faced also kind of opposition from stakeholders, in particular those exporting abroad, more particularly in the genetic sector, avian genetic sector. And they were fully opposed to this idea of vaccination. So you can see that you can find, if we extrapolate to the US, also the same breaks, I would say, in terms of advancing this idea of vaccination, the problem of trade, and I will come back on this issue of trade, which is very, very particular and has to be, of course, taken on board to decide or not vaccinating the flocks. Next, please. So, preliminary from the outset of our discussions, internal discussion, the possible rollout of vaccination against HPAI in France, we had very clearly in mind the general principles that would guide us. And the first of this principle, that vaccination should limit or at least attenuate the rate of the spread of the virus. And that this management tool, so vaccination, would complement management measures already in place, and in particular biosecurity. So very quickly, we began to think about modalities in which vaccinations should be deployed. And we had in mind that this vaccine should be a preventive vaccination and not an emergency one, which from the very beginning of the problem, it seemed to be the only technically feasible option to be implemented. Vaccination also should necessarily be accompanied by a strict surveillance to ensure that the virus do not circulate within the vaccinated farms. And in other words, to be sure or to ensure that the vaccine do not mask the virus. The strategy to be deployed also would necessarily be a DIVA strategy, so making it possible to differentiate antibodies directed against the wild virus from antibodies generated by the vaccine. And finally, we decided that the entire vaccine strategy would be presented to our trading partners, more particularly our neighbors within the EU, but also, of course, trading partners outside the EU, and with a coordination with the European Commission. So all these conditions that would be to have to be respected in an intangible way would be compliant with biosecurity principle, considering that biosecurity was and is still the fundamental pillar of prevention against the spread of the disease. And also, if France was to switch to a vaccination program against HPAI, this vaccination should be compulsory to all the species concerned, with a few exceptions, and I will mention it after that. And also something to bear in mind that if vaccination was deployed, we should apply all the animal health policy, and in particular, the culling of the flocks where the virus would be detected. Very important also to have that in mind. Next. So now I will present the vaccination plan itself. So next. So to be very simple, I would say, just to present this strategy. So the main objective was to have a collaborative and a collective reflection about vaccination. So we decided that it would be a preventive vaccination. I told that already. We decided also to focus on ducks and these different breeds of ducks, Muscovy, Mullard, and Peking. And why ducks? Because finally ducks appear to have, or duck farms, I would say, appear to have the biggest number of outbreaks, in particularly in the southwest of France, and because also ducks seem to be very sensitive to H5N1 virus, because they have a huge capacity of excretion, and because they were raised and still raised in open areas. Very difficult to raise them in indoor, I would say. So the vaccination would be deployed in all mainland France, not Corsica, because we don't have the same problems with this island in the Mediterranean Sea. And period of time, it will cover the whole year. So the first campaign started on October 1st, 2023. And so now we are beginning of 2026. So it's the third year of vaccination. Please, next. So as I said, this vaccination program is fully part of a regulatory European framework, which has been revised early 2023. So we could, in October, rely on this new regulatory framework. This framework also issued by, of course, and adopted by the European Union, rely, I would say, on ancient opinions of EFSA, in particular regarding surveillance, and I will come back again later on about surveillance. So we decided to have a compulsory vaccination in duck farms, in all duck farms, except in the breeding farms, hatching farms, hatcheries, where you have exports. So this would be a good guarantee to our trading partners importing avian genetics. So in particular, avian genetics of ducks. So no vaccination in hatcheries. It was also decided to prohibit vaccination for the other species, Gallus and turkeys, all different species. And of course, at reproduction stage, it was also prohibited. So it was finally only in ducks farms for, the production of meat, and in particular the production of foie gras, that vaccination was compulsory. Next, please. You have here a map of France with a different region and what we call department, which is a subdivision of region at administrative level. And you can see in red the density of duck farms, I would say. So we have two main places or regions of production of ducks. Western part of France nearby Brittany. So you see it's quite red, pink, intense pink, what we call Pays de la Loire. And more in the south, you have the traditional region of production of foie gras, the Sud-Ouest, where you have a lot of duck farms. So at that time, at the very beginning, before launching the vaccination program, we estimated that we had to vaccinate about 64 million ducks. And in 2,700 farms, mainly in the western part of France. Next, please. So now, what about the vaccines? That's a very important issue. So we knew that, of course, this vaccine would have to be effective against HPAI clade, virus clade 23444B strain. This vaccine should also the capacity for a DIVA strategy using NP ELISA serology, so new peptide ELISA serology, and DIVA strategy is, as I said before, this strategy allowing to differentiate antibodies against the wild virus and from antibodies generated by the vaccine. Very important to know if the virus was still circulating in vaccinated flocks. Of course, this vaccine should have received an authorization for use, and this authorization at that time was being granted by our national agency for vet medicines, Agence Nationale du Médicament Vétérinaire. So all this information is fully available on this website. We launched several calls for tenders, and two vaccines respond to the demand. One vaccine produced by Boehringer Ingelheim Laboratories, which is Volvac Pest, and the other one produced by SIVA. The name is SIVA Response, SIVA Laboratories. So you have the details and the features and the characteristic of these different vaccines. They can be used on all different species of ducks. Boehringer Ingelheim vaccine has to be used subcutaneous, unlike the other one from SIVA, it's intramuscular. The conditions of conservation, of Volvac vaccine much easier than for SIVA. You have to maintain it at minus degrees, 60 degrees minus during several months, and just before using it. So when it is in the veterinary premises, you can put it in the positive cold, I would say, at 8 degrees Celsius. It's degrees Celsius. You can vaccine at day 1 of age. It's only for Muscovy ducks, and when you use Volvac, so the Boehringer Ingelheim, you cannot do that. And both of these vaccines, of course, offer the possibility to differentiate the antibodies, which is very important. So for these two vaccines, it's not mentioned on this graph, you need to have 2 injections. So so day 1, and then it can be 10 days after for Boehringer Ingelheim, and 3 weeks, I guess, for SIVA. So at that time, for the very first time, the state and French government bought through this calls for tender 141 million doses for 1 year of vaccination for this 2,700 establishments. One thing very important to have in mind, it's before authorizing these vaccines, our agency launched trials on the field because we lacked at that time data from an epidemiological point of view and how the ducks could finally respond to this vaccine. So it was very important to launch trials on the field and to collect data. And finally, ANSES agency published 2 reports. It was in May 2023, so 6 months before the launching of the campaign, with very good results in terms of protection of the animals, the absence of excretion also from one animal to another one. So based on this positive results, we decided to launch the campaign. Next, please. So this is also something very important, and it was finally provided with by the European regulation. So if we wanted to put in place vaccination, we should also implement a new scheme, a new program of surveillance. Of course, we had surveillance, a passive surveillance in the farms, and it was the way that we could declare and report previously the outbreaks. But with the vaccination, we should reinforce vaccination surveillance with 2 pillars. One reinforced passive surveillance and one reinforced active surveillance. So the reinforced passive surveillance relies mainly on farmers, the producers, and technicians working with the farmers with weekly surveillance. So every week, 5 dead animals should be sampled with swabs. These samples would be sent to recognized laboratories for virological tests by RT-PCR, real-time PCR, for identifying the M gene, and it's a way to detect all the avian flu viruses. And if this test was positive, then H5 H7 screening was launched. In parallel, we also asked the veterinarians to implement surveillance. So every month they should have gone to all duck farms for virological analysis, and also for each batch of ducks, just before sending them to a slaughterhouse, this batch should have also been analyzed with serological tests. So every 30 days, every month, swabs from 60 animals were taken, and also 20 blood samples for animals which were intended to go to slaughterhouses were also tested. So for the virological tests, exactly the same method than for the passive surveillance with the RT-PCR engine tests. And we add to the virological test this serological test by NP ELISA, which is the test giving us the possibility to make this or to implement the DIVA strategy. And in that case, all the samples should be tested, analyzed in what we call approved laboratories, which are approved by the Ministry of Agriculture. So something quite heavy, quite difficult also to put in place, but I will come back again on this issue when we talk about costs. So to follow, of course, the campaign vaccination, we need recording systems, IT tools. We developed some of them just for purposes. Some others exist already. So Calypso, for example, was developed for veterinarians. So it allowed them to follow their own surveillance in the vaccinated farms, index farms, and also to follow the vaccination itself. So it was a tool for the vets. Then SIGAL was a system already existing to have an overview of all the data collected, gathered by the laboratories. So we had, well, this database. And at the end, Cartogip, a third system dedicated to the farmers themselves. And also that system enabled us to follow finally the movements of ducks from vaccinated farms. So these three systems combined could give us, and still give us, a very overall picture of the state of vaccination, but also of surveillance of all the farms, duck farms, eligible to this vaccination program. Next, please. So now I'm present you the cost, because it's a question that regularly I've been asked about the prices. It's interesting to see that with this model of vaccination combined to surveillance, finally, when you see different percentage and the proportion of the cost, of course you have the purchase of vaccines. So it's 22% more or less of the whole cost. But you have also the interventions in the farms. So it's part of the logical part of the vaccination. But at the end, maybe the most expensive activity was related to surveillance, so 28%. So you see that finally, more or less, half part for the vaccination and all the intervention in the farms for vaccination, and the other part is dedicated to surveillance. So surveillance in that case is essential, but it's of course quite costly, because a lot of people, a lot of staff, you have veterinary, you have technicians intervening in the farms, but it's necessary. It's a real a pillar, I would say, in this program, and it's of course compulsory. It is provided by the European legislation. Just one thing about surveillance. Of course, when we started this program, we were relying on, I would say, old school principles in terms of surveillance, because at that time, when the European Commission reviewed the regulation, the European Commission didn't have time to review completely the system of surveillance. So we rely on ancient principle. But at that time also, the European Commission sent a mandate to EFSA to review these conditions. So EFSA released, maybe last year, a new opinion on surveillance of vaccinated flocks. And this should be transposed in a new regulatory framework, not released yet by the European Commission, but this would allow member states to have a much simpler system of surveillance, and of course, I would say cheaper or less costly. That's very important also for the next member states who have the willingness to launch also vaccination programs. Next, please. So just to have in mind, finally, the total cost of this vaccination program. So finally, for the two campaigns, 2023-2024 and 2024-2025, so second year of vaccination, same amounts, 95 million euros, the whole campaign, covering both purchase of vaccines, implement vaccination itself, and surveillance. During the first year, the government decided to help, of course, the private sector, and covered 85% of the whole cost, and the private sector only 15%. And during the second year, negotiations have been relaunched between French government, private sector, and it was decided at that time to lower the level of participation of coverage of the government. So it lowered to 70%, and of course, private sector had to increase its participation around 30%. So this year you don't see any features, but it should be the same, 95 million euros. Costs has more or less stayed the same, and have stayed the same. And the participation, the coverage between French government and private sector is the same also. So this has been completely transparent. We sent all the data to the European Commission, so it is publicly available to report that the European Commission released, I guess, on its website. Next, please. And you have here some features about the price per dog, I would say, considering the purchase of the vaccine, the act of vaccination, and the analysis for surveillance. And so I draw your attention that finally the total cost for 1 ton of live weight of meat, I would say, of ducks, is around 150, 170 euros. So it will be a little bit more for in dollars per ton of live weight. Next. So now epidemiological outcomes, results, just to see finally if it worked or not. Next. Yeah, so you have data from the 3 campaigns, the first one, the second one, and the one currently in progress, I would say. So 1 year of vaccinations from 1st of October to 30th of September. First year, we vaccinated finally 61 million ducks. Last year, 54. So apparently there was a reduction in the duck production. It's the same in terms of number of establishments. We have done less in 2024, 2025 compared to 2023, 2024, but it's more than 2,000 establishments. This year, of course, we restarted a 3rd campaign on October 1st, and currently we have vaccinated 14 million ducks. You can see on the map, finally, the region and departments where the vaccination the most intense, I would say. So it's Vendée, this very intense blue in the middle, west part of France, and more in the south, what we call Landes department, where we have this duck farms for production of foie gras. In the eastern part of France, of course, no vaccination in some departments because there is no duck production. So it's quite a lot. And we are very proud, finally, to have succeeded in vaccinating all these ducks in all these farms. And now it's something that is quite, our veterinary services and even the veterinary field are quite familiar now with this kind of campaign of vaccination. Next, please. About in 2023, 2024, during the first campaign, we noticed that we could have some outbreaks in vaccinated farms. So we went through thorough investigations in that farms, and we saw that this kind of farms could have been infected because ducks were finally infected at a very young age, so they were not completely protected by the vaccine, even if they were vaccinated at day 1. And also in some farms, for ducks over 11 weeks of age, you could have also, some outbreaks, and we knew that from the very beginning when we launched, these trials on the field before launching officially the campaign, we knew that after 10, 11 weeks of age, the immunization was decreasing quite a lot, even if birds received 2 injections. That's why we have decided for the 2 previous seasons of vaccination to add a booster, a new shot In some areas, so the high-risk areas where you have high density of duck farms, so it's always the same farms where you had this very intense vaccination activity, I would say. So just underneath this migratory flyways, alongside the Atlantic coast, and during, of course, the high-risk season. So it is in winter from 1st December to March 15. The first year, during the first season, we have injected a booster for 1.7 million ducks, and the second year to 2.1 million ducks. So, and this year also, we have decided to add these booster shots also for 1-2 million ducks, just to protect them all along their life until they are slaughtered. Next, please. So this is during the first year, but it can be replicated to the second years, next years. It's the number of vaccinated ducks per week. So you can see more or less it's more than 1 million ducks vaccinated every week. It's consistent with the figures I shown before. I showed before about for a whole year, it's 50 or 60 million ducks vaccinated. You can see that regularly we have a kind of decrease in the amount of vaccinated ducks because it corresponds to, well, a moment where the ducks are slaughtered for the production of foie gras, so that's completely normal. But more or less, you have a little bit more than 1 million doses injected per week in duck farms. Next, please. So, if we go now through the outcomes, the number of outbreaks, we declared after these two first campaigns of vaccination. Now we are in the third one. I just can tell you that it's amazing how it worked so well. If you remember, we were about 400, 500 outbreaks per year, and we had 1,400 during this period, 2021, 2022. And for the first campaign of vaccination, 2023, 2024, we had only 10 outbreaks, 10 infected commercial flocks. I don't speak about backyard, but it was just a few of them. And amongst these 10 infected commercial flocks, we declared 2 infections in vaccinated ducks. So we went through these investigations, and it's the conclusions were the ones I told you already. So animals infected before a total protection, and also animals infected at the end of their life. So the reflection on a third injection, a booster shot. But it's incredible when we see also the second campaign, 2024-2025. We had 11 infected commercial flocks declared, 4 vaccinated farms with outbreaks, but more or less it's the same. And we were able during these 2 years, in 2024 and then in 2025, to recover our free HPAI status during at least 7 months, from February to August, for both years, in 2024 and in 2025. So you can see how it has significantly changed from the previous years without any vaccination. So we were able to reduce, of course, the number of infected flocks just by targeting a very sensitive species, which is ducks in that case, and to have finally a time of peace with this period of where we were free of HPAI. It's true that during this period of time, in these 2 years, the viral pressure from the migratory birds certainly was lower than it is right now. Because since last October, we have declared much more outbreaks. You can see 133 right now. I don't have the number of vaccinated ducks or farms with infection. I guess it will be more than 4, maybe 10 or 15 today. Of course, it's not finished. We still are in the high risk period, but we can see that the dynamic is reducing right now compared to the previous weeks. So maybe we will be at around 150 outbreaks, but compare to the previous years and before launching the vaccination, it's at the end a success. So vaccination helped us a lot in reducing, of course, the number of outbreaks, not only for duck farms, but for the whole poultry sector. Next, please. So a few words about trade, and it will be the end of my presentation because I see time is running, but yes. So of course, we deploy a huge diplomatic work with bilateral, multilateral discussions, a lot of technical exchanges, replies to questionnaire that we received, in particular with the United States and the APHIS and with Canada, CFIA. We have, of course, changes our health certificate with some countries. Yes, we faced some bans, it's true, and we faced two bans from the United States and Canada, but we were able finally to lift them. We have been very transparent with all our interlocutors, with all competent authorities from third countries. They came to France, and in particular, a joint mission a delegation came to France last year. It was in September 2024, yes, if my memory is good, from APHIS and CFIA. So they came to see how it was concretely implemented in the farms, how the surveillance system worked, and so on. And finally, we could, I would say, lift all these problems, these difficulties by showing very well, you see the results, and showing also that our exports were safe without any, I would say, problems or difficulties with this virus. Well, the fact the virus could be masked because our surveillance system is very robust. Today, maybe we still have some discussions with Japan, but finally, with the other country, everything has been lifted. Next. Yeah, and also because before launching all this bilateral discussion, we went to see how at regional level and also at during the General Assembly to promote vaccination. We worked in very close collaboration with the European Commission, with the other member states. We had a lot of discussions with CVOs in third countries. In particular, at that time, it was Rosemary Seaford and Mary Jane Allen for Canada. Very fluent discussions, I would say, on vaccination, and we made everything publicly available on our website of the Ministry of Agriculture, and we replied to many requests to show how this vaccination campaign was undergone. Next, and I think it's finished. Yeah, so you can find all the needed information about this program on this the website. You have the correct code. You can scan it, but anywhere this presentation will be spread. So, and don't hesitate if you have any question to ask me. I will be available to answer. Thank you.
Thank you so much, Dr. Martins Ferreira and Dr. Kuiken, for these great presentations. We have had so many questions roll in. You can feel free to turn your cameras on. And my thought was that we've kind of organized the questions so that we can go back and forth between both of you. And my colleagues are helping behind the scenes if any new questions roll in that are burning. So the first one that I have here is for Dr. Kuiken, and this is, I think, related to your remarks about intensification of poultry production and some of the pitfalls of that from a One Health perspective. So we have a poultry vet who wrote in, how do you balance the fact that for any given amount of poultry production, the resources such as water, carbon footprint, and acreage used per bird are decreased as production is more and more intensive?
Yeah, that's a good question. Thank you very much. I think that there you need to balance the beneficial aspects of intensification in reducing a particular, let's say, feed or emissions of certain pollution against the negative aspects, namely reduced welfare and also increased risk of infectious disease. And for some of the pollution, it doesn't matter if they are being produced by animals that are kept extensively or intensively. It doesn't matter because it comes into the air anyway. In some cases, it's very important if it's in an intensive area. For example, with nitrogen, the effects of nitrogen pollution are much stronger in an intensive farm than in an extensive farm because there are many more animals together. So I think from a One Health approach, if you take these things into consideration and you're saying you're wanting to optimize also animal health, also of animals on the farm, and optimize ecosystem health, then you have to find a balance somewhere in between there, but it wouldn't be going all the way to intensification. So this is all considering that you have you keep the same number of birds, whether you keep them more intensively, so closer together, or not. However, in practice, this never happens. Once people start intensification, things become, there is less need for feed, for example, and then people keep more chickens or more poultry of other species. So you get an increase in the total number. And this is what we're seeing also worldwide, that the total number of poultry continues to increase at this amazing rate of 500 million per year. Over.
Okay, thank you. I'm going to just switch over to a question for Dr. Martins Ferreira. This is related to the vaccination program in France. And we understand now that you have data for several years. So can you estimate what percentage of HPAI outbreaks have been prevented with the vaccination program? That, a number that could be used in models when other countries may be trying to predict the impact of launching their own programs.
Yeah. So apparently depends on the pressure, and each year the viral pressure from migratory birds, wild birds, and it changes from one year to another one. But we had a study published 2 years ago, so it was maybe 9 months after the launch of the first campaign by the Veterinary School of Toulouse through modelization. And simply they said, well, if we haven't vaccinated these flocks, we would have exactly the same amount of outbreaks than in the previous year. So 400, 500 outbreaks a year. So we should, I don't have new inside figures about that. I think because this year seems to be more severe, I guess the scientists will try to rebalance or to reshuffle maybe their modelization, because it changes apparently year to year due to these different, viral pressures.
Okay, that makes sense. All right. I'm looking at the time, and we technically have 5 minutes left, but I think we started our Q&A a little bit late. So if everyone is okay for 10 more minutes, then we'll plan to try to get in as many as possible in that time. Let's see, the next one here for Dr. Kuiken is there any impact from breeding and lack of biodiversity in parent stock on spread and vulnerability to HPAI? Or is this mainly about density of poultry independent of genetics?
So I don't know if this has been studied scientifically, but I can imagine that having a genetic, very similar animal in a big flock, if all the animals are genetically similar, it allows the virus to adapt to that particular genetic variant and therefore spread more efficiently. So from that point of view, it's probably so that the virus is able to evolve more efficiently in a genetically very similar flock than if it was a very heterogeneous flock. Over.
All right, and for Dr. Martin Ferreira, is there data available on whether the vaccination program has reduced the incidence of HPAI in wild birds or mammals in France?
No. I've seen some figure this morning from our national agency, and apparently not. It has no link because finally, well, I'm a scientist, I'm vet, but not so expert, but apparently you can have an action on domestic, of course, by protecting them, and biosecurity also, associating biosecurity measures. On wild birds, it's not really possible because you are not vaccinating them. So they are not, I would say, in general, they're contaminated by themselves, finally, not from domestic flocks. So it's not because
you're not having spillback from
yeah, exactly. No spillbacks exactly from the domestic to usually not. So it hasn't changed finally. Quite nothing, because this year apparently we have quite a lot of outbreaks and dead birds from the wildlife infected by H5 and H1N5 viruses after these 2 years of vaccination. So you see there is no real consequences finally on the wildlife because it's unilateral. It doesn't return back to the wildlife. That's a good question, but I've seen this morning that finally this year in France we had a lot of also infected wild birds. So no real incidents.
And Dr. Kuiken, did you have anything to add? I saw you nodding at one part during that question.
No, I agree completely with Dr. Martin Ferreira. Indeed, in Europe, there's hardly any spill over from domesticated birds to wild birds. I think there's only one, I only know of one incidence where from genetics, you could see that there had been, I think, a duck farm in Hungary where there had been spread from domestic ducks to wild birds. But otherwise, that's not the case. It's indeed a one-way direction. And as it were, in this case, the poultry are the dead-end hosts.
Okay. All right, and then this question was going back to you, Dr. Kuiken. It was related to some of the maps that you showed that show regions with very high poultry density, but few or no recorded LPAI to HPAI conversion events. How should we interpret these apparent gaps? And do such areas, whether truly free of conversion or potentially underdetected, could those areas pose any meaningful risk to other regions through poultry movements, trade, or shared wild bird pathways?
Yeah, it's a very good question. Indeed, you mustn't consider that surveillance of HPAI in poultry is the same all over the world. And indeed, it's possible that in some countries, particularly those that have a lower income, there is less money to pay for intensive surveillance, and therefore more chance that you would miss a conversion from low to a high path AI. And there is some risk of a virus going from there to other neighboring countries by poultry trade, for example, and spreading the virus. Yeah, there is that's the possibility. Yeah. Okay.
I guess emphasizes the One Health aspect of all this, that countries are not really separate in this world of HPAI. All right, and then Dr. Martins Ferreira, I think you had mentioned that there were some new surveillance recommendations that may be being released. Any estimate of when those might be coming out?
So the opinion has been released from EFSA. Now it has to be translated into regulatory framework. And I've learned by my colleagues that there are working groups dedicated to this new scheme of surveillance. I have no idea of the date of the publication. I would say first the adoption and then the publication of this piece of legislation. But we hope to have it for next year before relaunching a fourth campaign of vaccination. So it will allow us to reduce finally costs. Cost is very important, cost of surveillance, but in the meantime, giving the same level of security, which is very important to our trade partners.
And this is maybe a related question on that front. Are there any point of care tests for HPAI that are part of the French vaccination program, or do all the tests need to go to a laboratory for testing?
Yes, everything has to be to a laboratory for testing. You have these two different kinds of labs, as I say, recognized. So they are held by private sector, I would say, mainly. And you have these approved ones, which are more under control of the Ministry of Agriculture, so more in the public sector.
All right, I think we probably have time for one more each. Let's see. For Dr. Kuiken, is there any good data on farm size and HPAI risk, assuming that other factors like the location or biosecurity practices are kept the same? In other words, is there any guidance on, from an HPAI prevention perspective, if there is a certain number of birds that is maybe drastically increases the risk of HPAI if you have that many in a certain location?
That's a very good question, and it's a question I would very much like to be able to answer, but I cannot. If you talk about the conversion of low path avian influenza virus to high path avian influenza virus, it's a sporadic event, and we don't know very well how big a poultry farm needs to be and how closely the animals are kept on such farms for an event to occur. And because it's so sporadic, you can't test it in the field, and because it's such a difficult thing to do, it's also not possible to kind of emulate such a system in the laboratory. So we don't know. We only know that having more birds closer together theoretically increases the risk, and having less birds further apart lowers the risk.
And that's the risk of conversion from LPAI to HPAI, or for contracting HPAI even?
Both, actually. So no, both. Theoretically, it increases. It also increases the risk of a virus coming on a farm if you have more birds on it that are closer together. Yes. So in contrast to what some people think, avian influenza virus isn't so infectious. So you actually have to have quite a lot of. Animals have to be packed quite close together. Certainly, if they're not in the water, like poultry are, for a virus to spread through the flock. Yeah. So on a very extensive farm, it's not so likely that it actually will spread very easily across the whole flock, but in an intensive farm, it will.
Okay. All right, and coming up on the last question for Dr. Martins Ferreira, who was responsible for administering the HPAI vaccinations in France? Was it government services, farmers, or contracted personnel? And how did that choice affect consistency, compliance, and oversight?
Good question, because it's something very particular to France. All veterinarians in France practicing have receive a kind of mandate from the state. So they have, of course, they have their private affairs with farmers, but in some cases, because they are registered of the National Board of Veterinarians, they have the obligation to put in place, implement health animal policy affairs. So in some cases, and in this particular case of vaccination, they have a cap, a public cap, I would say, and they endorse this public obligation to implement vaccination. So it's something very particular to France. People from competent authorities coming to France, visiting us, are a bit amazed to see that public sector can also respond to public obligations, but it's something that works for decades. It dates back to the 50s, and we have been eradicating tuberculosis, brucellosis, and many, many other diseases in livestock farming. It works, but of course it's competent people, veterinarians, practitioners, and of course, they go to see their clients. It's true, it's their clients, but they have the obligation to implement public policies. It's just like that. And for these particular tasks, of course, they are paid by the state, by the government.
Thank you. That is very helpful. We really appreciate both of you coming to share your perspectives. I am just going to share our final slide here as I do some final concluding remarks. Let everybody know about the CE component. Let's see. All right, I think that is up there. So yes, we just wanted to thank you both so much, Dr. Kuiken and Dr. Martins Ferreira, for sharing your expertise with our big audience today. I think we were up to about 140 attendees. And thank you everyone who has attended this webinar. Before we sign off, we did just want to highlight a recent op-ed on HPAI that I wrote along with VAFAW's senior policy advisor, Dr. Ellen Carlin, which was published by Stat News. The op-ed recommends that the USDA Secretary Rollins approve the targeted use of HPAI vaccination in poultry to mitigate this outbreak that continues to devastate American poultry operations. Doing so would align with significant bipartisan congressional consensus on the pressing need for the USDA to advance a workable poultry vaccination strategy. And as far as today's presentation, we will be posting a recording of it on VAFAW's website in the coming days. Certificates of participation for CE credit will be emailed over the next week to veterinarians and veterinary technicians who are VAFAW members and attended the webinar. If you haven't joined yet, just enter your name in the Q&A to sign up for your first year of membership at no charge. And also just a reminder to please fill out the short survey that will show up on your screen after the webinar ends. If you have any questions, please don't hesitate to email us at info@vafaw.org. And thank you again so much for joining us today.